We answer questions all the time on what type of tractioning is for me. Now, for some of you out there, this conversation might be a little bit odd because, well, maybe you aren't at the place where you're capable of even thinking about getting set up in a tractioning unit. In fact, we should probably take a really big step backwards right about now and just recognize, in order to get to a place where we can even talk about the topic of what type of tractioning device is right for me, we've got to talk about, have you gotten checked? I'm Dr. Joseph Baker from the Limerick Chiropractic Center. And if you haven't ever been checked by a chiropractor, you need to pause and not go any farther in this video. In fact, my best recommendation for you is to get your system tested. Have your spine checked. Because here's the thing, everything else that follows after this doesn't make any sense unless you know, unless your doctor knows what type of problems you have. And when I say problems, I am talking about the condition of your spine. The average American is almost 50 years of age, over 600 maintenance adjustments behind schedule, 4,000 or more impacts into this body, into this spine of theirs, by the time they enter into the chiropractor's office for the very first time. Why would we ever guess at what condition your spine would be in? That's insane. So for me, the very first thing is to make sure that you get checked. In fact, at the end of this video today, we're going to talk a little bit about an opportunity that's coming up in our office, just simply to make sure that you have an opportunity of answering the question, what condition is my spine in? What phase of degeneration am I in? What type of tractioning is going to be best for me? Because like you see behind me, these units that are up on the wall here, these devices are designed specifically to get rid of scoliosis, to remove bends in the spine that aren't supposed to be there. And if you're not familiar with scoliosis, it's when the spine, instead of it growing nice and straight, grows with that curvature from side to side. No, it's not normal, but it is common. And there are certain individuals that happen to be more prone to it. In fact, mom and dad, if you're out there and you're listening to this video right now, guess what? If one of you has scoliosis, your child is 25% more likely to have it themselves. If both of you have a tendency towards scoliosis or have it, then guess what? That number can go up to 75% likelihood that your child is going to have that. And hence the reason why we talk about making sure that you get checked. And the sad thing is that in today's day and age, guess what? Most children are never ever checked for scoliosis. Now sadly, what they are given is the opportunity of screwing up their neck royally from hello. I can't tell you how many 3-year-olds I see with a phone in their hand. And you know what? Unlike you would have with any other device, there's no instruction manual on how to use this thing properly. They don't tell you. They just say, here. And what do? Well, you just give it to your child and you say, here, watch this video. I want to occupy your time. The sad thing is from a very young age, we're destroying the neck. And hence, there's a whole category of diagnosis codes on what's called tech neck. It's sad, but in our realization, we have developed this problem in our children at younger and younger ages. And therefore, you know what? Unfortunately, we get to see breakdown and degeneration happening sooner and earlier and of a much more devastating level. Now listen, once we've gotten to that point where we've understood the fact that there's a problem, there's a situation, depending upon what part of the spine it's in is going to determine the type of tractioning that we use. And, you know, when we talk about tractioning, for some, you might maybe use a device like this, which would be for the low back area, or for the thoracic area, the chest and the mid back. And then you have other devices, you know, as like simple blocks. This is called a degenerate, which aids in restoring and very gently bringing that curvature back in place in your neck. But for others, it requires more force. It requires a little bit more attention. And the wonderful thing is that there are devices like this, what's called circular tractioning device, that are designed to specifically remove different postural distortions in your neck. And for some, like myself, we love the fact that we're able to get our correction, we're able to be up and moving, and this is what's called a CerviGuard. And in turn, this device we're capable of setting up directly for your spinal condition based upon your x-rays. In fact, the wonderful thing about this device is that we can do stress tests with you in this, which helps us better understand the corrective process. It tells us how far your body's willing to go, and we can tweak the setup based upon how your body is presenting. But let me stop. And let me reiterate, just like we started this conversation just a few minutes ago, listen, if you've never had your spine checked, if you've never had it tested, that's the very first place to start. You would never go over to your garage, bring your car to the local mechanic, and just simply accept the fact that he put his hand on the hood of your car and told you that maybe you needed a new starter or new injectors. You would look at him like he's crazy. Guess what? You would expect for him to open up the hood, run diagnostic tests, make sure that he has a full understanding of how this piece of machinery is working before making those recommendations. And the sad thing is that there's so many individuals that go to chiropractors and they never see what's going on inside the body. That's not okay. Your health is that most valuable thing, and our desire is to first seek to understand what's going on. And hence the reason why in our office, and we have an event coming up, it's called a Patient Appreciation Day. It's where we give you the opportunity of making sure that your friends, your family members, have the opportunity, the ability to get checked and to see what type of condition their spine is in. Now, sadly, the most difficult part in this entire process is people just simply recognizing the need to test their system. And that's where you come in. I realize that, you know what, during the course of my day and for my team, we're bound by the four walls of our office. And yet I recognize that you have that opportunity and the ability to help your friends, your neighbors, your loved ones by doing some very simple things. Number one, just simply liking this video helps it on Facebook. Number two, leaving a comment on what your takeaway was. Because as you're leaving that personal comment, friends and family members are just simply pausing to see what you recorded, what you put out there. And then lastly, sharing this information. I realize that, you know what, as we take a moment in time to simply share this information, we don't know how far reaching it's going to be, but what we do know is that we have done our part in just simply seeing that this great message is passed along to somebody else. So I ask you to do those three things. Like, comment, and just simply share this information so that others can learn just like you know now. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.